Assalamualaikum and very good afternoon to boys and girls of UM4, and I hope that you are enjoying yourself at home, and we have a good prayers for Malaysia and also to the world, and we hope that this pandemic disease will be cured as soon as possible. Miracles do happen, yeah. So let us continue with our lectures, and I feel a bit weird that I'm talking to an empty class, but I think you are with me and will be enjoying my lectures throughout. Yeah. So I can see the captain over here, and we have two bodyguards of captain as usual for your class rep. So let us move to next. We have finished our metabolic disease lectures, guys. So now we are moving to another disease. We have talked about pregnancy toxemia. We have talked about milk fever. One is calcium level, and another one is glucose. Now let us move to a disease called SARA. Alright, so I have given the notes to you all, and I have highlighted what is SARA. Let me explain to you all. It is not a name of a person, guys. It's not like when you study in your kindergarten, oh Sarah, Sarah, what you will be, you know, to dream about the songs. It's about a disease called SARA. It is subacute ruminal acidosis. Boys and girls, normally I will ask you all to draw. So let me draw my beautiful diagram, I guess. Looks like it will be a cow basically, or a goat. As you know, the ruminants have four stomach. We have four stomach. So basically, this is the mouth part. The important of the mouth part is the saliva. Yeah? This has the bicarbonate. And we have the rumen. It's a fourth stomach. Rumen is very important in this context. Why? Because the real stomach is the hemomesum. It is acidic, H+. But over here is alkaline. And who helps this alkaline condition over here is the saliva. Bicarbonate will help the maintaining the alkaline solution over here. If in a case what happened is that when acid build up, that's where you have two types of disease in ruminant. It's called ruminal acidosis or SARA. Yeah. Ruminal acidosis or SARA. So basically, guys, when you talk about SARA, SARA is a disease where it is due to an abrupt change of feed from roughages to concentrate. Why? Again, the question why? Why? The farmers want to make more money. They want to change the diet to have a better diet in order to increase the milk production. But for long-term or period, it will cause a loss in the production of the animal. So boys and girls, again, when you mention about acidosis over here, the normal pH of rumen is between 6 to 6.4. As I've mentioned over here, is (6 to 6.4) is the normal thing. Yeah. So you must remember these figures, guys. 6 to 6.4, then 5.5. Reduced than 0.5 is known as ruminal acidosis, or it can cause subacute ruminal acidosis. So what really happened it always occur in dairy cows and during dairy production, where when the animals just after the dry period, the farmers tend to change the diet from the roughages to more concentrate. So when it has more concentrate, the digestion will have more volatile fatty acid, VFA, volatile fatty acid, that will be produced and lactic acid. In ruminal acidosis, guys, the lactic acid will be produced a lot. But in this case, for SARA, is VFA. Again, what is that? Can you pronounce again? VFA, volatile fatty acid, volatile fatty acid, VFA, volatile fatty acid. And this volatile fatty acid normally absorbed by the papillae of the rumen. You have studied your anatomy and physiology of rumen structure. It will be absorbed by the papillae. It will be absorbed by who? The papillae of the rumen. So when it absorbed by the rumen papillae, then it will be used for what? It will be used for the milk production. Yeah. So in this case, during the period of Sarah, lactic acid, the rumen rarely cause depress in pH. What causes a depress in pH, guys? The excessive accumulation of VFA. Why? The rumen papillae couldn't absorb the extra production of VFA. So when volatile fatty acid couldn't be absorbed by the papillae, so what will happen is that there is excessive production of VFA. This is excessive production of VFA. So again, it will cause, again, one more thing, when you change the diet, guys, when you change the diet from the roughages to concentrate, where you know that ruminant likes to move your buccal cavity, bukan sebab nak gossip, yeah? It's not because they want to gossip or they want to talk, as you all, okay? When there's no lecturers in the class, you like to make noise sometimes, but sometimes you like to see your Instagram, am I right? Now I'm not sure what you're doing at home, but I'm sure that you are reading your Merck's manual, am I right, guys? You're reading your Merck's manual, you're looking at all the clinical case reports, you're reading your rounds, I guess, and preparing for your comprehensive exam and your final project and your test too. Am I correct? Betul tak? Ataupun anda masih tengok Instagram dengan Twitter, looking what's happening in the world, or are you thinking of UPM? Alright, so let us go back to the picture here. Yeah. So again, guys, so accumulation of polytic fatty acid and reduced rumination, reduced cut chewing, rumination. Sebab there's no roughages, guys. Tak ada roughages, so kurang mastication takes place. So there's less saliva produced. When there is less saliva produced, it will cause the buffer changes occur in the ruminant pH because less bicarbonate is produced. That is the basic physiology of rumen. Yeah. So this causes the formation of SARA. So when pH is less than 0.5, what is the clinical signs you can see? The clinical signs are quite mild, guys. It has reduced rumination, mild diarrhea, and appearance of undigested grain. This is sometimes you can see in the feces of the ruminant, there's undigested grain in the feces. And perhaps, well, you can say so, but sometimes, most of the time, we'll miss that clinical sign. We will miss. Kalau you have missed the clinical sign, don't feel so bad that I have missed the clinical sign. Myself has been experienced more than 10 years in the farm level. We also miss the clinical sign. So how to diagnose this, God? How to diagnose? Okay, how to diagnose is that this particular episode of SARA, what is detrimental is the chronic phase. When it happens, the chronic phase, it will cause laminitis. It causes what? Laminitis. It causes laminitis, guys. Then it causes what? Weight loss. Then what? Poor body score. Poor body score, Then sometimes unexplained abscesses. Okay, I would like to share a thing. When I was last year, because through your lectures, I have an idea to do a final year project for 2021. So you can tell your juniors, right? If anyone want to do a final year project, I need 3 students, I guess. For SARA, come and see me. Because why? This is my experience in the field, guys. Last year I went to 2 states. I don't want to mention which states, but most of the farmers, the dairy farmers, they kept the animal on corn. They fed on corn and soya, but they have reduced the feeding towards the grass, roughages. And they mentioned after the third calving, fourth calving, with a high production, the animal tend to have laminitis, weight loss, poor body condition, but the feeding mechanism they gave was same as 3 years or 2 years ago. The high production of TMR, or it has a lot of concentrate. But they felt that there's a lot of weight loss laminitis, and I myself have seen a lot of unexplained abscesses. So when I was going through the literatures, it triggered me out. Can this due to be SARA? And when we Google in Malaysia, is there any information about this? They have done any study on this? I can't see that. I can't see that, guys. If you have gone through that, please share with me. We are learning each other, yeah? So please share with me. But currently, I don't have that data yet. What is the SARA status? Yeah? What is the SARA status among the ruminant livestock? Basically, dairy cows, or dairy buffaloes, or dairy goats. No answer yet. Overall, Malaysia. So, how to test this dog? Okay, guys, when you have laminitis, weight loss, poor body condition, when you talk about laminitis, it has abnormal in the feet. When it's abnormal and feet, normally it causes disruption in the reproduction cycle and also production of the ruminant. So when you have this, it will cause high herd culling rate. So can you see that we are talking about preventive medicine here? When you have high culling rates, what will happen is that, well, if you are a farmer, the important thing is what? What? The cash flow. The cash flow of the farm are compromised. When the cash flow is compromised, the farm is going to have a serious problem. So again, this disease, although it doesn't cause high mortality, guys, but it may cause high morbidity, but chronically the farm is going to have high culling rate. So again, as I told you, although this is when you study about disease, there's infectious, there's non-infectious. When you study about infectious, you have detrimental clinical sign. This is non-infectious. But guys, boys and girls, you look over here, it causes the farm to lose production due to high herd culling rate. But this is chronic subacute chronic acidosis. So please look into it. So how to test this dog? Very simple. You see the milk fat content. In milk, we have milk fat content. You must remember that milk fat synthesis is due to fiber digestion. It is due to fiber digestion, guys. You look over here, the milk fat content in normal cow should be around 3.5%. If let's say you take the cow's milk, then you test the fat content. If it's less than 3%, it shows that the animal is suffering from SARA. So you must remember that you must test individual animals' milk, not as a bulk. If you test as a bulk, you collect all the milk at one go and test as a bulk, the test is insignificant. So we must collect sampling in a farm, random sampling of the animal, but normally the cows that have just calved down, first 60 days after calving, or other word, 2 months. 60 days is equal to months. If you are living in the planet called Earth, the planet called Earth, 1 month is 30 days. Betul tak? UPSR 30 hari kan? Kalau you lulus UPSR, betul lah 30 hari. 60 hari is how many days? 60 days. 2 months. You can't remember that? Peace. Peace is 2. So 2 months, yeah? 2 months again. First 60 days, you must test. So you look over here, you test individual milk test provide a better indicator. And another thing test is how? Rumen content. You have to get the rumen fluid, guys. But how to do the rumen fluid? How to test the rumen fluid? How to do the rumen fluid? Either stomach tubing or how? Ruminosynthesis, which you need a 16 gauge needle, 5-inch long, but you go on the ventral rumen and it's very invasive procedure. If you have done it wrongly, it can lead to peritonitis. So it is another way, it's an invasive thing, but you be test with milk first, screen first, then look at the clinical sign as I told you, where changes in feed happen. Most of the animals show laminitis, weight loss, poor body condition, abscesses. But if you see that before the chronic thing, you see earlier is the animal has mild diarrhea, then you see you observe the feces is not well formed. Okay, now perhaps SARA. It's basically to look at the record and the feeding mechanism, guys. So ruminal synthesis is another thing to look through. If 30% of the cow sample have ruminal pH less or equal to 0.5, consider the whole feeding group experience SARA. It means that 30%, let's say you have 10 animals you sample. Let's say that the farm has 20, you took 10. You sample 10 animals, 3 of them show pH 5.5. It means that the whole herd you have to do changes in the feeding program. Yeah. So this is SARA, subacute ruminal acidosis. It causes a major loss in dairy production of animals, particularly ruminant animals in cattle industry and goat industry. So any questions? And of course I know that no one's going to give me any question except for Mr. Zaid sitting down there. Okay, but if you have questions from your home, any geographical region in Malaysia, any geographical region outside Malaysia, but you couldn't go out outside Malaysia currently because the rules have imposed from starting tomorrow, but please do email me and we discuss the question together, because normally we always have questions and answer session NOP. So we have finished our lecture on SARA. Now we look at another disease called metabolic acidosis, guys. Alright, we have talked about SARA. Let us talk about acidosis. Yeah, metabolic acidosis. So when you talk about metabolic acidosis, ruminal acidosis, okay, ruminal acidosis is ruminal. It shows that it's at the rumen region. It caused by acidosis. Why acidosis? Okay, yang ni, this is a story lah. Yeah, it's a story that when we were in kindergarten, in Tasca or preschool, we call it now in modern preschool. Preschools, like pre-universities, like Form 6, we say pre-universities. They have changed the work to be more stylo or something like that, guys. So when once upon a time he was 6 years old or 5 years old, okay, I know that everyone is getting aged now, betul tak? So our grandfather or grandma will say, jangan tamak, nanti rugi dia tu. Jangan gelojoh makan, nanti tersedak, betul tak? Don't be so greedy, you will lose a lot of things. So I assume this disease due to greediness. Why? That particular cow or goat love to eat a lot of grain than usual, and the farmer also want to be greedy sometimes, but doesn't know the basic physiology of the animal. They give a lot of grain overload. So bila grain overload, it means that excessive concentrate were given than roughages. Again, guys, back to basics. Yeah, what a ruminant should eat. Ruminant should eat grass. Ruminant should eat leaves that has chlorophyll, basically grass. Why are we changing the paradigm that God has created? Okay, so if we follow that nature that as God has created, we can avoid all this disease. And secondly, we must educate our farmers to have good feeding program by understanding the production and physiology of the ruminant digestive system, guys. So grain overload. So what will happen when there's grain overload? As I told you, rumen needs acidic, acidic or alkaline? Alkaline condition. So over here, any ruminant, doesn't matter it's a cattle, buffalo, goat, sheep, deer, okay? Rusa, deer, doesn't matter. Any ruminant is susceptible to lactic acidosis. So what is important, as I told you in large animal, the important part is this history taking and also physical examination will determine you the problem list and the first three differential diagnosis. History taking is very important, guys. That's why vets are trained to be observer. Vets are trained to listen and digest. Listen and digest. A good listener will give a good results. That's a term in any management. You have to listen first, digest. Same thing. Listen here. Listen the history. Digest the history. See, observe. Yeah. Because patient history must have high fermentable feed, high soluble carbohydrate. For example, wheat, barley, corn. Okay. Last year I went through a farm in Kuala Kangsar. You know dia bagi apa? Keripik ubi, goreng, fried keripik they gave to. Then she claimed that the animal is doing very well, produce a lot. I said, how many liters of milk? Only 3 liters. Cattle can produce up to 15 to 20 liters. And this is not her fault. This is a lady farmer. Not her fault, but she have not been taught the right way. Yeah? So our job as a veterinarian to do our extension services to give the knowledge to the farmers, guys. Then the industry will go. So clinical fundamental variable in this case, but you look over here, it's very acute, 12 to 36 hours, daripada 12 jam hingga 36 jam sahaja, ya. Then you will see the symptoms of anorexia, lethargy, depression. Wow, we have muscle tremor and ataxia. Maksudnya bahagian otot dan sistem saraf akan dipengaruhi juga, ya. Why? Why? Because why? Because it disrupt the ruminal microflora. It disrupt the rumen microflora. Yeah, it disrupt. You know, you look over here. When you see exhibit bruxism and grunting, it means shows what? The animal is pain, guys, in pain. For example, contohlah anda sakit perut. Let's say you add a lot. Pernah tengok iklan Ino tak? The ambulance come, Ino. Because why? You feel uncomfortable. How many of your stomach is uncomfortable? You feel so good and you can sleep. Anyone? You won't feel good. Same thing in animals. So they feel grunting, yeah. So they will have some sort of diarrhea, acidic smell, but this sign is not that fast to show, yeah. But you can see when the animal have this. Another finding is herd problem. It's a herd problem. Feces, this week you see a grey and porridge-like structure. Dairy cattle experience what? Decreased milk production. Kalau lembu susu itu menghasilkan 10 liter susu pada hari ketika tersebut. Wah, bahasa Melayu pada hari ketika tersebut, pada waktu kejadian, yang dimana ketamakan lembu memakan banyak konsentrate akan mengakibatkan susunya menurun hampir 80% ataupun 70%. It means that the animal that has been given huge amount of concentrate with experience acute acidosis will cause decrease in milk production, guys. Decrease in milk production. You must remember that. So what really happened, doc? What really happened in this case, guys? So over here, my friends, boys and girls, as I told you in SARA, you have VFA and lactic acid. But in this case, only VFA doesn't cause that much. What it has caused is that the detrimental bacteria comes in. This bacteria, because in rumen has good microflora. When there is a changes of alkali and acidic condition, the pH changes. It causes changes in the microflora, where it will be replaced by Streptococcus bovis. It will secrete two acid, D and L. Which one? D and L. D and L acid. So which one is good? Which one is bad, guys? You look. If you forget which one is good or bad. Pernah pergi sekolah rendah kan semua? Dari 1, 2, 3 pernah. Have you went to primary school before this? Okay. If you have a mathematics exam, if you get a D, how you feel to bring your marks to your parents? Mesti takut kan? Nak minta mark sign. Mesti takut tak? So D is like detrimental grades for you all. So remember, D is cause detrimental ruminal acidosis. Faham tak? D. Grade D. When you are in Form 4, I know, when the teacher gave you additional maths, for example, first topic is function, or in physics, the first chapter, tolok screw micrometer gauge, ataupun vernier caliper to calculate the ralat parallax, plus minus everything. You make the wrong, you get a D. You feel, I feel sad, but I need to study a lot. Because Form 4 normally first 3 months everyone will fail many subjects. Do you agree with me, guys? If you talk about chemistry, you talk about JMR, JAR, mole to molecule, molecule, ion to mole to gram to mole to volume, 24 dm cube, 22 4 dm cube, STP, standard temperature pressure. You have talked about it all, but guys, but D grade. Kalau you dapat, even now your test you get D, you feel sad. That's human, am I right? So by that, always remember in your head, lactic acid D cause detrimental ruminal acidosis. This case, not the excess production of VFA. Sarah caused excess production of VFA. Rumen papillae couldn't absorb. But acidosis is different. It's lactic acid by the bacteria. Which lactic acid is D. Boleh faham Adik-adik semua faham kan? Okay. Now, so this causes a lot of toxin production, So accumulation of VA produce rumen status, extracellular water flow, and it causes diarrhea, hypovolemic, and you look, it can cause circulatory failure, collapse, and metabolic acidosis. So again, it causes circulation disturbances. So you look, and this is very important. It causes corrosive nature of lactic acid chemical ruminitis. Okay, what do you mean by that? Okay, let us go back to your basic science. Basic science. Kita kembali pada your Form 2 pada zaman dahulu zaman dahulu. Okay, when I was Form 2, saya tahun 1995. Remember that. I was in 1995 Form 2. Very interesting year. Sekolah petang, seronok. Okay, so we study science. Air dan larutan. I remember the topic. Air dan larutan. So they will talk about pH. Then we'll go on Form 4 physics, acid and base. Then we go to Form 6 or pre-university. We talk about pH is negative log H plus or OH negative, guys. So when you talk about pH, there is pH 1 to pH 6. Then we have pH 7. Then pH 8 to 14. This is alkaline, this is neutral, this is acidic. For acid, the value low, acid kuat, strong acid, betul tak? Alkaline, the number above is alkali kuat. When you study your Form 4, apakah tu acid kuat? What is strong acid? The deassociation of H plus ion. Okay? Deassociation of the H plus ion. Ion itu separa, okay, ataupun penuh. Deassociate fully or partially. But am I correct, guys? Okay, so when you talk about pH 1, so that's where you call strong acid. when you study in your science Form 1, you have the symbol for corrosive material, am I right? You have the symbol. So when you have corrosive, when you have corrosive acid, it will cause, for example, when you have corrosive acid, you have other acid quite. When you put on your finger, all of a sudden, mak saya nampak tulang lah dekat kaki kanan saya. Tulang, strong acid is corrosive. Corrosive, it will dilute all your tissues. Same thing, guys. This one will cause rumen-itis. It means that when it's a post-mortem lesion, you can peel off the rumen mucosa. So that is called strong acid in ruminal acidosis. So the important, you have to get the rumen fluid. Again, if you look over here, guys, pH 5.0 again. pH 5.0. Again, you must know able to do the rumen stomach tubing to get the rumen fluid. Then once you get the rumen fluid, you test the pH first, then get a microscope. Please see under the microscope is any protozoa living or not. If there is no protozoa living, you have to do rumen transformation, guys. If not, there is much things can be done. But over here, then also you can do a gram staining to show it's a streptococci. This is the diagnostic thing that can be done during ruminal acidosis. So in this case, let us look what is our treatment plan as a clinician. What you should do. Number 1, prevent further access to the feed. Jangan dibagi dia makan the concentrate. Orang yang tamak ni kalau you letak macam-macam makan, suka makan. He like to eat. So you stop feeding the animal from the concentrate. Stop. Stop first. Then move to what? We administer sodium bicarb. You are the farm. How many of you all like to bake cake? Encik Akis is here today for me. He likes to bake things. Sodium bicarbonate you can buy from the shop, Tahu kedai? Walaupun zaman daurat ni dekat ni, they impose we cannot restrict movement, but kedai runcit buka yang jual makanan. So you can buy sodium bicarb, try to bake something over there, and you post the video to me. Can you all do that? It's a joke, guys. But if you want to do it, why not? So sodium bicarbonate, this is the thing, 1 gram per kilogram. If the animal is 500 kilogram, 500 gram. Then how to give it? Just mix in the water, oral drenching to the animal, so that it will give an alkaline solution in the rumen. Alright? But there is one study I want to share with you all. I was reading this journal. And this journal I've gave you all. This is a current study that was done in Indonesia and Perth University. They have done this study. They mentioned about using sodium bicarb. Is it good to treat this? They say, well, it was in the textbook, is good. But let us go back to your chemistry, Form 4. Let us go back to your Form 4 chemistry. Chemistry Form 4, calcium carbonate. Ini dapat daripada siput daripada siput semua calcium carbonate. When it react with acid, it give you what? Calcium chloride plus CO2 plus H2O. Am I right? Correct, guys? Betul? You look at any carbonate, when it dissolve, it will give you CO2. And CO2 is a acidic compound. Now, the scientists, they have found out that because its rumen is already acid, when you give bicarbonate, it helps. But when over a period of time, it will give out the gas of CO2, it will give more detrimental effect. So they have suggested to use magnesium hydroxide compared to bicarbonate. So you look, magnesium hydroxide added to the rumen culture could prevent the lactic acid accumulation, while sodium bicarbonate supplementation did not prevent acidosis and had lactic acid accumulation. So if you look, that's why I've told you always we must keep reading. Textbooks say different thing. When you have done a lot of research, this clinical research, it say otherwise. But doc, can we emergency still use sodium bicarb? Yes, you can, because currently it is acidic, too acidic, the rumen. So you replenish with an alkaline stimulator. The alkaline stimulator is sodium bicarbonate. What is that? Sodium bicarbonate. But if there's a choice in your bag of treatment, magnesium hydroxide, please go for magnesium hydroxide. Okay? Faham? Then if the animal showing very detrimental sign, you can't do much, you see all the protozoa dead, it is sternal or is still standing but too depressed, emergency ruminectomy should be done, surgery. But procedure, if the case still good at surgical risk, you must assess surgical risk. Whatever surgery to do, guys, if it's under general anesthesia or local anesthesia, please do not forget to assess the animal still under surgical risk. We tend to sometimes overlook these guys. Clinicians, you're going to be the clinicians. Don't overlook the basic concept, boys and girls. Basics must be there. Macam kita belajar huruf B-A, ba, C-A, cha, baca. So that's basics. B-A, ba, C-A, cha. So the basic of surgery is to see the surgical risk. So in this case, boys and girls, although it's a local anesthetic procedure, but it's still a surgery, you must look at surgical risk. Then you see. Okay? So you look and you have told poor prognosis for recovery coupled with surgery and therapy for metabolic acidosis. And you must remember, when you do this rumenectomy, you must have a rumen transformation. Macam mana? Get the rumen fauna from a healthy cow. Get it ready. So that when you have done, you do the rumenectomy, you remove all the content, replace with the new rumen content from the donor. Okay? But don't get the donor also have the acidosis lah, guys. Lagi teruk pula. Okay, so you have to look at that. Alright, so satu lagi we are talking about here. In ruminant is a preventive medicine. Kalau let's say the animal is depressed, poor prognosis, but when you do the surgery cost is higher than the animal, but the animal can be culled for makan, ataupun you can give pisau mycin, okay, an antibiotic that I created. Pisau mycin, pakai pisau, you slaughter, so we slaughter lah. Recommended animal to slaughter if economic did not dictate the surgery, and animal will pass on antibiotic postmortem. So culling is another option of treatment in terms of severe cases of ruminal acidosis or poor prognosis, boys and girls. So you must remember that. You must remember that. That is another thing. So another thing is that it's a heart problem, and you should have a preventive management. What is a preventive management? It's about feeding management, boys and girls. The feeding management is important, as I told you. Grass and concentrate carbohydrates given must be according to the formula. If not, it will give you a detrimental effect. Alright, so with that, we finish our lecture on metabolic acidosis.
Alright.
Hi boys and girls, we are back again. Okay, I'm doing a reality show now. It looks like doing a reality show. I have to make up again. Okay, again. So hope you are fresh again at home. You are watching my lectures while you are sleeping, or perhaps you are driving. I'm not sure not you are driving. You are sitting in the car, or bawa pokok kelapa kan, merenung masa depan dengan tengok lecture, atau makan pisang goreng, cempedak kat kampung. Alright, so let us go. So this is our last topic of the few lectures under the topic called diarrhea and ruminants, guys. So normally I end my lectures with having a good photo with you all, but I'm having my lectures with a group of chairs today. Alright, so let us talk about diarrhea. Prior to talking about diarrhea, let us look at the GIT tract of digestion, guys. Okay, for human, okay, we'll talk about human is about around the same. Okay, stylo rambut baru juga. Okay, so guys, as you learn in your form 2 on digestion, and you learn on your form 4 of biology on your digestion, guys. So basically, digestion starts in the mouth. Okay, there's physical and chemical digestion. When you talk about chemical digestion, there's saliva, amylase enzyme. Then it goes into the esophagus. It causes peristalsis. Once it's peristalsis, it goes to the stomach. Am I right? Peristalsis. Then it goes to the stomach. In stomach, you have HCl. Then you have which enzyme you have? Which enzyme? Protein digestion will take place over here, right? Over here, carbohydrates digested. Yeah. So acid hydrochloric will make sure all the bacteria has been killed and make sure it's not harmful. So, but then the stomach will be acidic condition, so that enzymatic activity takes place. And once the digestion in stomach has taken place, the output from the stomach is called chyme. Am I right? CHYME, chyme. Then over here you have your liver. Then you have your bile duct, guys. Can you recall? So you have bile juice over here. The bile will be going out. Then also you have your pancreas. So you have pancreatic juice, am I right? So pancreatic juice give you what enzyme? Malas. Kamu tengah bermalasan kat rumah kan? Tak. So maltase, lactase, sucrase. So bile will go into the duodenum. Okay, so we got emulsification of fat. So emulsification of fat will take place. The carbohydrate and the fat, the protein will be digested to get amino acid to have the glucose. Am I right? Then you have the villi system. Your biology, your villi system. Then you have your lacteal system. Lacteal, am I right? Then the capillaries are there. The small compound amino acid and glucose will be reabsorbed. Where non-soluble vitamins, which is non-soluble activity. Kamu suka adik kamu kan? So adik will reabsorb the lactal system, will go in. Then later on, it goes to hepatic portal vein. Am I right? This is your physio, hepatic portal vein. And it goes back to the liver to process. Then this absorption villi is important. Then it goes into the large intestine. Then you defecate. Okay. What is diarrhea? Okay. What is diarrhea? What is diarrhea, guys? So we have experienced episodes of diarrhea during our lifetime, and we know how miserable diarrhea happens. Particularly when you are sleeping at night. You have to wake up and run to toilet because of diarrhea. What causes the diarrhea? Diarrhea is caused by whom? It's caused by, again, the environment prior. You have environment, you have host, you have the agent. So it's caused by the infectious cause. It can be a virus, it can be a bacteria, it can be a protozoa. But it is caused by infectious cause. And it will affect what? Now, it will affect what? It affects your small intestine. It affects your large intestine. It disrupts the villi. It disrupts the absorption of it. Disebabkan dia mengganggu fungsi untuk absorption. It disrupts the absorption. That is the reason there is accumulation of fluids. Sometimes detrimental bacteria will release the toxin. The toxin will lead to accumulation of fluids. A lot of fluids accumulated, it causes diarrhea. It causes a movement of fluids out with the feces out from the body system. At the same time, some bacteria are very detrimental, guys. You have learned in your anatomy class, you have learned in your histology class, you know there is goblet cell, mucus, everything. But when there is a parasite or bacteria goes into it, it can disrupt the mucus over here, and the mucus can be detached and you can find it in the feces. And it can be also bleeding. Betul tak? Betul tak? So this is the basic thing. Why am I'm going back to your basic? Because your treatment plan is based on this, boys and girls. This is your basic. Kalau diarrhea, dia tak ada treatment plan. If you have a lot of diarrhea thing, what the first thing doctor will give you? He will replenish your fluid therapy, electrolytes. If it's too dehydrated, what they will give you? They will give you IV fluids. Am I right? If moderate, subcutaneous fluid. So that is one thing. If you're too weak, they will give you glucose thing. They will give you glucose supplement. Same apply in animals, yeah. Same apply in veterinary medicine. Then if let's say there's a lot of bacterial infection over here. Of course, what will happen? Pyrexia will be there, boys and girls. Pyrexia will be there. I've taught you. When is pyrexic? What you have to give? NSAID. And NSAID depends on the severity. You see animals having high fever, looking at the condition of animal, mild, moderate, severe. Then you taper the dose accordingly. Which one is BID, which one TID, which one is SID. You go IV or you go IM. So have I told you before, yeah? Then, of course, another thing is what? Antibiotic. Sometimes you have to give antibiotic, but prior giving antibiotic, you must stabilize the patient lah. If you don't stabilize the patient, it's too dehydrated, you give antibiotic. That's wrong. You have to stabilize the patient, then only you go on antibiotic. Don't rush to treatment. Always I've told you, do not rush to treatment. Don't rush. As clinician, think calmly. Sit down and think. But of course you need to pray lah. For me, I will pray like, oh God, am I doing the right thing? Guide me. So that's very important in treatment. Please look at the principles. So these principles over here, they have mentioned over here. What is diarrhea? Have many causes. So it's all infectious, bacterial, viral infection. Yeah. Intestine fail to adequately absorb the fluid, guys. Absorb the fluid. So it will cause what? Dehydration. So again, infectious over here we are going to study today is about coccidiosis, salmonella, colibacillosis, Johne's disease. Okay, I will talk about you today. So virus, rotavirus, one of it. But can we isolate the virus easier? No, we can't much. You look, the famous word of the century now, coronavirus. So in ruminants, do you have coronavirus? Yeah, coronavirus, not COVID-19. Okay, because of COVID-19, I'm speaking to the chest today. Alright. So, but it caused, you know, coronavirus. What happened, guys? It also affect the respiratory, but it's also affect the GIT and bovine virus diarrhea. This is all respiratory, at the same time also the GIT, guys. Yeah. So, but basically all these viral diseases will have bacteria. Colibacillosis, E. coli, one of the most common disease of severe diarrhea in calves or young animals or young kids in the farm due to what? Sanitation. Poor sanitation. The feeding is too much of contaminated with poor water quality that has E. coli. I will talk to you a bit on this later. I have come across about 3 cases on this. And salmonella, as I told you, between gram-positive and gram-negative bacteria, which one is more detrimental, boys and girls? Gram-negative bacteria. Gram-negative bacteria is too detrimental because it has endotoxin. And salmonella is the most worst bacteria I've seen, later we'll talk about it. I've seen, in this case, last I saw was 2007, I think, when I was an intern. The cow is standing somewhere there. I'm in over here. I can see when the cow defecates, you have a shooting pipe. It goes that fast. And we have isolated that bacteria. So that's how dangerous or how detrimental that bacteria is. So what is the treatment, guys? Treatments, treatment are very similar regardless of cost. Specifically, treatment is often not possible in the case of diarrhea, boys and girls. The important is correct the fluids. That's important. Dehydration. Correct the fluids. Correct the acidosis. Okay, acidosis, loss of salt. Antibiotic and sulfur treatment, and I'll go down. I'll go another thing. Let us look at Merck's manual. Okay, this is from your Merck's manual. Again, they have shown to you what is the basic bacteria. So coronavirus is again there, boys and girls. Okay, E. coli is there. I want to go on the treatment. I want to touch on the treatment first. Then only easy for you to understand. So over here, you look, many of the factors involve the disease resistant or specific. Treatment includes fluid therapy. Again, fluid therapy. Electrode replacement, correction of acid-base disturbances, and alter the diet. Then, of course, we give antimicrobial and NSAID. So again, you look at the treatment over here, boys and girls. Treatment here is fluid therapy. Over here, I'll go for IV or subcut. Depends on the severity. Alright, that's number one. Number two, what else will you do? Guys, what else? Number two apa? What else? Alter the diet. Contoh, diet must be altered lah, guys. Sometimes you have to give more hay, perhaps not more grass, because certain grass have the water content more. For example lah, macam kita makan satu kedai, okay, we add some food, purchase some food in a shop, and we know that particular shop gave us the diarrhea. Once you are okay, once you took the medication, you go back to the same shop and eat the same food that caused the same diarrhea to you. Would you do that? No. So we are going to remove the cause. Then antibiotic, and finally is what? Finally is NSAID. Why? You want to reduce the inflammatory reaction that takes place in the GIT tract. Okay? You want to reduce that. So this is the basic 4 things that you must remember, boys and girls. Fluid therapy, diet, antibiotic, and NSAID. So fluid therapy will go by one. What type of fluids are there? They are lactated ringer. You can add up with bicarbonate. Lactated ringer and bicarbonate. That is very important, in order to have correct the dehydration status. Okay, boys and girls, if you look over here, in this notes, Merck's manual have stated very clearly. Over here, you look, you rapidly administering a hypertonic solution of sodium bicarbonate, either 500 ml or 4.2 solution percent. So you look at sodium bicarbonate, but it's rapidly. And sometimes in the animals hypoglycemic, you give glucose. So it's all about fluids, my friends, boys and girls. It's about fluids. Help the animal to replenish its fluid and also the energy. Alright? And NSAID comes in, okay? Analgesic, anti-inflammatory, antipyretic. So let us go now into the lecture one by one. Okay, I have told you the basic of diarrhea, the treatment, everything. So over here, the first disease that normally they encounter all over the world and also in ruminant industry is BVD, bovine virus diarrhea. But normally it happens in young cattle, months to years age, but it's normally happen in intensive environment. Okay, why intensive? Everyone is so closely. Now currently, COVID-19. Now what we are doing is that social distancing. That is the reason I cannot find any one of you in the class. So can we all say hi from your home? Hi. So now we are social distancing. We are putting ourselves away so that the virus won't grow together. Because virus need the life cells. So it's same thing. So when you have viral disease outbreak in ruminants, particularly during diarrhea, it's about intensive system, intensive care, management system, yeah, because they are closely packed each other, yeah. So in this case, there are many things, but the important, as I have highlighted for you, is mild enteric and mild transient diarrhea. Sometimes we can miss this thing off, and acute is always fever, profuse watery diarrhea, and it can be, as I told you, in the respiratory diseases, it can have a respiratory sign and also some ocular sign. This is what we mentioned over it. But this one can be very detrimental, very acute can be very detrimental. If you ask me, I've seen this for a few years ago. I didn't manage to see much cases on this. Or maybe I may miss the thing because when the animal becomes so chronically infected, then the farmer will complain to us. So chronic enteric disease, animal appears stunted with rough, dirty hair coat. Oral examination reveals the occasional erosion with blunted oral papillae. So it means that during the physical examination, if you think of BVD, please check the oral papillae. So you can see for the chronic cases, there will be blunted oral papillae. So you can see that thing happen, guys. So it is caused by pestivirus of the Togaviridae family. So what is the diagnostic plan? So again, you look at diagnostic plan over here is that it's about history taking. You see the history and clinical examination, diarrhea, shallow oral erosion, central corneal opacity, and interdigital erosion. That's a hoof problem over here. And lab tests, not much. Any viral diseases in ruminant will give you leukopenia. So what is the therapeutic plan? So when therapy is attempted in the severe cases, treatment consists of, again, you look, fluid therapy, systemic antibiotic. So it's the same. So here, fluid therapy and said antibiotic, again for this detrimental. I assume this case is quite severe. You go back to IV fluids, go for bicarbonate. If it's weak, you go for glucose, 5%, or for me, I will start up with 20% glucose perhaps. Then I go back to lactated ringer, then make sure NSAID are given. Because virals can cause paraxic as well, my friends. So isolate of clinically ill animal, isolate, so you know what we are doing now. So we are isolating ourselves at home. So vaccination can be practiced, but in Malaysia there's no vaccine yet. Right, so there is BVD, that's first disease. Next disease, diarrhea, is known as, I need to open a file, give me some minutes. Okay, this is interesting. Bovine malignant catarrhal fever, Bovine malignant catarrhal fever. So this is a disease caused by herpes virus, It's caused by herpes virus. This affects okay, this one I have personal experience. It is nice to tell to you all. Okay, it happens to me personally. In year 2007 and 2008, our deer population farm, we had a history of bilateral blindness and unilateral blindness. And you know, deer, if it's blind, it's a wild animal, it couldn't get their food. At the same time, they get so much of stress we have found 2 animals died due to stress, due to blindness. So myself, I remember those days I have, we are young, even though now we are young guys. With Dr. Azlan Cik Ahmad, you know Dr. Azlan Cik Ahmad? So he was there at the time with me, and 2 pathologists were around, Prof. Justice in UNK, Prof. Nordin. So we went and to investigate this disease, So what we saw is that the deer farm is located near to our goat farm, and the workers that is goat farm also feeding the deer farm, and from there we suspect it is a bovine malignant catarrhal fever. How did this thing happen? The clinical sign, it has high fever, tachycardia, profuse diarrhea. It has diarrhea, guys. It has diarrhea, it has blindness. That is the important thing. Diarrhea and blindness. And I've seen a case in the same farm. The animal had head pressing. It pressed its head, the deer, so pity. It pressed its head towards the ground and towards the wall. So we put down this deer. Then we did our postmortem. What we found is that the important thing is this. Here. Clinical sign is over here. Before that, you must remember, it's caused by herpes virus. You know who's the carrier of this herpes virus? It's the goat and sheep. They won't come down with a clinical sign, but cattle and deer can come down with a clinical sign. So once we found that this disease is due to that, we stopped the movement of the workers from the goat farm to the deer farm. The case resolved in the farm within 2 months. So the diagnosis over here is always postmortem is the best diagnostic tool. Because serologically can be done, but virus isolation is difficult. So what we can see over here, boys and girls, is that there is corrosion of the. I'll give you this. Over here, you look. This is the history of the farm. So the animal will have depression, incompetence, poor body condition, blindness due to either unilateral or bilateral corneal opacity. And blood results show lymphocytosis. And post-mortem finding shows buccal papillae erosion, very significant buccal papillae erosion. Even during your physical examination, you can check the buccal cavity. If you see the buccal papillae erosion happens, then you suspect bovine malignant catarrhal fever. Yeah, guys? And is there any treatment, doc, for this? This is the answer, boys and girls. There is no any treatment. Once the animal got it, it's quite fast. It causes diarrhea. It causes nervous sign because the nature of the virus. And also it causes blindness. The welfare of the animal are compromised. So again, it's about farm management, how you allocate the workers in your... If you have cattle farm and goat farm together, make sure the workers are separated, the perimeters are fenced up. So this is called bovine malignant catarrhal fever, boys and girls. Yeah. Okay, next we are going into salmonellosis. As I mentioned to you, salmonella is one of the disease occurs worldwide and seen in all ages, species, breeds of animal, and is always compromised with the histories of stress. And you must remember that salmonella also happens in other species, and mostly that we are so cautious is about in poultry. So I think you remember that poultry, they have a routine examination on salmonella. The heart and respiratory rates are elevated. They are severe. You look severe watery hemorrhagic diarrhea with mucus, fibrin, Calss, and blood clots. It means that the whole tract has been out. It's quite detrimental. Severe watery hemorrhagic diarrhea with mucus, fibrin, clot. The animal evidence of abdominal kicking and and also pregnant animal can be aborted. And it can lead to septicemic, acute enteritis and chronic enteritis. And the presenting syndrome in cattle is acute enteritis, boys and girls. So it is mostly Salmonella typhimurium and Dublin. And pathogenesis, as you know, is oral inoculation. Some are carrier animals, and it will give you anemic. The animal will go into severe shock, and is the prognosis normally grave to poor to grave, guys. And we need to have antibiotic of selection over here. Short-acting antibiotic. They want us to give short-acting antibiotic and also more regular. Look at trimethoprim sulfa. They are giving twice BID, my guys. Gentamicin, 3 TID. Although the usage has been said SID, but for this Salmonella is confirmed cases, you have to go more detrimental antibiotic therapy. So that is the reason. If the animal, if you see on preventive medicine, if the animal, better to remove from the herds to avoid more animals are affected due to the Salmonella brought by this animal. It's better to cull and remove the animal from the herd. So it means that culling is another option for these cases. Culling is another option for boys and girls. So oral intravenous fluids are very important, and of the protectant. Treatment isolation, seek remove the contaminated food. But again, when you talk about Salmonella, boys and girls, it is not an easy disease to be speak on. It's not an easy disease, boys and girls, because Salmonella it can cause a detrimental effect. It can cause detrimental effect to the animal, and also it can give a high risk factor towards other healthy animals due to the excretion of the organism through this animal. So better remove from it. Before I go to another lecture, I'd like to talk about colibacillosis. So colibacillosis is another disease that you must remember. It affects the young animals mostly. This happens to me 2 years in 2018 and 17. Boys and girls, I went to a farm. This particular farmer reported that most of these calves are dying. They had about 10 calves dead within 48 hours, and another 20 calves are showing severe diarrhea. When I went there, when we saw that there is pinpoint hemorrhage around the buccal cavity, the tongue, and the first thing I did was I was so lost. I was like, okay. And the temperature, some animal having high temperature, some having hypo, so some are dehydrated. So when we questioned the farmers, did you change your feeding? So went with the students, So we went there about 10 in the morning. So I was there, of course, like I was looking. So the important thing is that you have to look at the farm history. So I was while you guys I assume you are my juniors, yeah. Boys and girls are taking the history. I went around the farm and looked at the feeding trough, the source of the water. So all of a sudden, I want to know the source of water. So I saw the source of water was from the well. So when I followed the pipeline of the water, I saw there are 2 wells. One is the sanitation tank, another one is the well, and it's side by side, guys. And if they are not close, and I'm not sure how deep is the well, would you think there's any cross-contamination takes place? I think yes, because the feeding, the water that has been given is not treated at all. So I told the farmer, why not? We start on treatment, so we start on the fluid therapy as usual, and we went back that day 11 o'clock at night. We started in the morning about 12 in the noon, the treatment. So we did the fluid therapy slow and steady, because calves you cannot go much very fast fluid therapy. We went, we gave and since once the animal stabilized, we go antibiotics. Yeah, but out of 24, I think about 24 treated, 3 died but we saved 21. We brought back during the postmortem. We saw typical lesion of colibacillosis, where we have all pinpoint hemorrhages, and also the small intestine are sloughing off, and we isolated E. coli. So again, the treatment are the same, but for severe cases, you need more longer period of time to treat, and very poor prognosis cases, you can't do much. But the important thing in the farm, what we did was that we asked the farmer to change the water. Okay? So he did what? He brought quite many tanks of mineral water and gave it to the cows for few weeks. And it was okay. Then he changed the whole watering system to a pipe water, treated pipe water. So that's again, boys and girls, the important message is that to remove the cause. Yeah. So that is an important thing to know the history of the farm. So next is the we are going to speak on a disease called Jaundice disease. Bukan roti John, okay? Jaundice disease, bukan James Bond ke, Jaundice ke. Jaundice, there's a restaurant, Jaundice, steamboat. Not that, okay? Not roti John also, it's Jaundice disease. Okay, how many of you all like to eat and eat and eat and eat, but don't grow fat? You don't need to do exercise. Although your age is catching up, your metabolism is getting low, but you like to eat a lot, you want to taste many food, chocolates, desserts, but you don't grow fat. How many of you all? But most of you all get fat all the time. Am I right? Put up some weight, then you diet back. How many of you all just want to have the food, but to maintain your body weight? So, but this disease is the other way. The appetite increase. Appetite is the same, but body weight decrease. Having bodies called, that's the important history. What I'm trying to say just now is important history taking is that animal farmer kata, doktor, saya punya lembu ni makan tak berhenti, tapi berat dia makin menurun. Saya pun tak tahu kenapa lah, dok. Makan banyak aja, tapi tak tambah berat, makin menurun. Itulah sejarah di ladang yang perlu diambil, perlu diketahui dengan teliti ayat-ayat tersebut. So that is called Jaundice disease. It occurs in adult dairy cows and beef cattle older than 2-3 years old. And the clinical sign is that it's an intermittent continuous watery pea soup. It's emaciated, become progressive, and milk production decreases. Terminal sign is profound emaciation, profuse watery diarrhea. So lama-lama dia watery diarrhea. It is caused by Mycobacterium paratuberculosis, and the important thing is that the organism is secreted of fecal root. So sanitation is very important. If the sanitation is not taken care properly, boys and girls, other animals will be affected also as well. Other animals will be affected as well. So sanitation, you have to take care very well. So following oral ingestion, so again it causes enterocolitis. Enterocolitis. It means that the large intestine, colon, will be enterocolitis. Okay, let us go back. Berapa orang basuh baju kat rumah? Soalan dia. Sekarang, of course, the class is empty. I couldn't listen any voice. But please shout from your home. Yes, I do. Or no, I ask my mom to do it. Or I go to Mr. Dobby to do it. Or I go to... Ni sekarang orang pergi kat mana yang tempat ada washing machine banyak tu. Alright? So last time, if you watch cerita P. Ramlee dulu, diorang naik basikal pergi mana? Tepi sungai. Alright? I have done that before with my late grandma. So we go near to the riverside, we bring our clothes, we wash, dekat batu tu kita buat. You rinse, you remember you rinse the thing? So you do it over the stone. I have done it many times till my grandma shouted at me because terkoyak baju. Sebab nak main air, what I do, I purposely leave the cloth over there so that air itu membawa bajunya lari, supaya saya boleh lari dalam air tersebut dan mengejar bajunya. So itu satu pengalaman yang seronok. I think most of you all don't do that. Last Sunday, My wife was going to a shop. I saw some of our UPM students were carrying a bucket of pails, of clothes. They went to Dobi. I was talking to her like, last time we go to the riverside, now they go to Dobi. So why not you do a class trip? Rancangan berkelana sambil basuh baju di mana? Di air terjun. Can you do that? Okay, it's up to you all. But it's a thing. Okay, why I come to that story? So you pernah tengok washing machine kan? Pernah kan? So washing machine pusing, rinse. I'm going to talk about that. Once you finish rinsing, where is the solution goes out? Ada satu pipe yang keluar air kan? There's one pipe. Am I right? Have you seen the pipe? Washing machine pipe? Have you seen that? I'm not sure sini ada internet. Let me see. There's internet over here. Okay, so this is washing machine outlet drain. I don't know how many of you have seen that. If you are in the class, I have that thing in my lab. I can bring you all. Pernah tak you all guys kan pernah sentuh tak this hose? Oh, nyamannya hose ni, bestnya, rupanya seronok. Have you done that before? And I'm sure you have never done that before. So sekarang, eventually you're at home. I know every one of you all has washing machine at home. So get the hose, minta kebenaran mak bapak, your parents, you ask the permission of your parents, open the hose, try to feel the surface of this hose. Just close your eyes and feel. Okay? Why I ask you to do so? You know why? Because, guys, because the enterocolitis, when you do rectal palpation, you feel like the washing machine hose. Dia punya corrugation. It has a corrugation. When you do the rectal palpation, you can feel the colon region over there. You can see a corrugation. And the corrugation, dia punya rasa adalah the feeling is same as the washing machine hose. Can you do that at home? Please do so. Because another way to confirm this disease is that, of course, the history. Secondly is that rectal palpation to see the corrugated feeling over there. Then it's called enterocolitis. So when colon is over there, it has malabsorption where we're producing enteropathy. You know that protein can be lost many ways. Albumin can be lost by many ways. One of it is liver. Liver. Another way is enteric problem. So when there is protein losing enteropathy, it will cause, what will cause? It cause disturbances in the circulation. It will cause hyperproteinemia. It will cause the hydrostatic pressure to lose up, and will cause edema. It will cause edema formation. So that means you can see edema formation in very severe cases of Johne's disease. So fecal culture is the most reliable. Fecal culture is the most reliable. So this is the sophisticated test, but we don't do it in Malaysia. I didn't see anything in Malaysia. So therapy, there's any therapy? No, there's none. It's test and slaughter. Okay, prevention, herd management. Disease may be kept in check on herd basis test and slaughter method. Removal of reactor. Calf must be removed from the dam. Problem with herd management, the disease effectively eliminated from a herd, but the management of changes require intensive, rigorous and expensive. Because of the inaccuracies of diagnostic test, there is yet no test and slaughter program that effectively. Therefore, the only method is elimination. You remove the whole herd and repopulate, and that is going to be very expensive. Yeah. So in some countries, guys, when it's still endemic, vaccination is there. So Malaysia, there's not much research as yet done, and no vaccination practice. Same goes for TB and this disease. Who knows in future it will be done? Yeah, it will be done, guys. So the last thing to share with you all. Okay, this is a slide, that real case that happened in a farm last year. Okay, this is a case where it is a brucellosis concurrent with jaundice disease. It's in a buffalo. It's a black kerbau ID. It's a Murrah buffalo. So the history, you look over here, guys. Losing weight for 1 month, but the appetite is the same. Dia makan sama dok. It's a Baguan Singh farm. Kata doktor, dia makan sama lah dok, tapi badan jadi kurus. Dia ni kerbau sebenarnya badan besar, baru cantik, lembu sado kan. It looks, they want a tough muscle, guys. So, but he also mentioned there is swelling on the scrotum up, come in and goes for 1 month. And the owner treated with what? Ivermectin. Right? He treated himself. He said it can be due to parasite. So I was looking where he got this idea from parasite. Or perhaps he's thinking of like human, cacing banyak, hilang berat badan. Itulah dia buat. Okay? So you look, guys. So reproductive site enlargement. So over here, the group came out with brucellosis, fasciola, and jaundice disease. So we do a rectal palpation and fecal collection and serum for RBBT. So that's me over there. So you look over here, not much changes can see, but it was positive for Brucella abortus and melitensis by Rose Bengal test. Rectal palpation, smooth surface lining of the rectum. It means that it's early stage. Okay, so you must do the rectal palpation in the case of jaundice, guys. You must. It's a must. That's why I ask you to feel the holes here. Then we do a fecal sedimentation, negative finding, no liver fluke, but Zil-Nelson stain must be done. Because for jaundice disease, guys, another test is to do is that you didn't culture the bacteria. But you take the feces, you do acid-fast staining, Zil-Nelson staining. You do acid-fast staining. If the animal is clinically affected by jaundice disease, there will be a lot of production of bacteria that will be released through the feces. Through what? Through the feces. So you will see there will be do acid-fast staining. If there is acid-fast bacteria in the feces, it is positive for jaundice. Then we can say, you look at, tentatively diagnosis is jaundice disease. But gold standard we use Harold's egg yolk, but it'll take to 2 to 4 months. And another more expensive is through ELISA. But they have mentioned over here, presence of positive acid bacterial feces, diagnosis of suspect jaundice disease can be made. Yeah. So in this is jaundice and brucellosis. And brucellosis need to calm, jaundice also need to calm. So treatment no. Why? Jaundice disease again is a chronic wasting disease. It doesn't respond to therapy. No vaccine available like in Malaysia. Further spread, yes, because of the sanitation. It spread with fecal oral route, guys. Culling is the best option. Okay? Brucellosis, also the same thing. Avoid all this breeding over this bull. So this is a DBS protocol. You screen the whole herd You have to do CFT, cull the whole herd that is positive, less than 3% tested positive, quarantine, more than tested positive, quarantine and vaccinate the herd with RB51, and retest every 4 months for 3 times, and to make sure it's negative, you must 3 times negatively, the results must be negative. So this is the case history that need to be shared with you all. Okay, before I come to the last slide here, I forgot one more thing. There's a lecture on bloat. Yeah? Okay guys, so we have done on that. Bloat is the last topic. Yeah? So bloat is due to sudden accumulation of gas. Sudden accumulation of gas will cause the bloat. It's either frothy or free gas bloat. So more commonly in cattle, frothy bloat, dairy cows, new growth, large pastures, free gas bloat will be there. There's more frothy or free gas bloat associated with chopped solid feed. So severe abdominal distension, increased TPR. Again, this is space occupying lesion. As you know, in pathology, you have studied space occupying lesion will cause. So when there's bloat, accumulation of gas, the diaphragm are affected. It goes forward, diaphragm affected, respiratory will be affected, it goes backward, there will be prolapse can take place, guys. Prolapse can take place. Alright, prolapse can take place. So again, how to diagnostically done is that passage of oral gastric tube to make sure it is frothy or free gas bloat. Remove the tube and again look at the pH of the end of the thing. And also acute bloat is one of true medical emergency, can die rapidly the animal, so must do the treatment acutely. Where alright, so we must remove the gas, and normally when we put the stomach tubing, we'll give mineral oil at 1 liter for 100 kg orally. Alright, there's one of the treatment. So sometimes we do ruminectomy as well, to remove the gaseous part. Yeah, I have a case report to share on this, I guess. I have emailed this paper to you, boys and girls. So this is a bloat in prolapse. So you can see over here, you see this animal, this cow is suffering due to difficulty in breathing. At the same time, it has prolapse because of acute bloat. It compressed the diaphragm. It also caused prolapse. So it's a typical case of severe bloat. So please read this paper and understand it. And if you have any question, you can email to me, and we can have a discussion together.